The levator scapula, the most common area where people have problems. If you're a patient or a chiropractor and you're dealing with levator scapula trigger points, I have a great solution for you. My name is Dr. Story. I've been a chiropractor for over 23 years. I'm going to give you realistic advice based on my experience. Here's what I've noticed. Most active release methods, Graston methods, all of those things that we use, myofascial release during motion, trigger point therapy, they all work really good except for one thing. They don't contribute to the neurological inhibition of that muscle which we're trying to induce. Very often you get your thumb on there and you have them stretch, you dig into the muscle, you do Graston. Very often you do it so hard that it starts to facilitate the muscle rather than inhibit it. So I'm going to show you a trick that I've learned over the years that seems to really work well. Now we all know how to stretch the levator scapula. What you would do is you would have them tuck their chin, bend forward, laterally bend and rotate to the opposite side. So if you're trying to stretch the right side, you would laterally bend and rotate and drop forward into flexion on the left side. That would stretch the muscle. The problem is with the stretch reflex, as soon as it starts to stretch and it knows, the levator scapula knows it has to hold up the head, it's going to start contracting at the same time you're trying to stretch it. So contracting the muscle and then relaxing it is one method, but what I've learned over the years is that if you have the patient lie down on their back, so you would have to imagine I'm lying down on my back and then do the same stretch, bend forward, laterally bend and rotate to the left-hand side. By overcoming gravity, you're facilitating the left scalene muscles and the right scalene muscles actually. So as you're doing that, it then reciprocally inhibits the levator scapula. So all of a sudden this gives new meaning to doing some type of active release or a myofascial release technique or trigger point therapy. I never do that seated anymore. I always do it supine. So a patient can actually be taught this on how to stretch the levator scapula as well. Very often we have them hold their head and pull it down. I don't recommend that. I let gravity do the work. So again, they're on their back. I teach them to flex forward, laterally bend to the opposite side, and then rotate. And then what happens is that neurologically inhibits the levator scapula and can give them much more long-lasting relief. If you thought this was interesting, give me a thumbs up, subscribe to my channel. If you have any questions at all, ask in the comment section below and I'd be happy to answer your questions. If you can, please contribute to my Patreon account. The Patreon account continues to allow this YouTube channel to exist. And also, if you have questions, if you are a Patreon and you have specific questions, I will make a video just for you answering those questions.